Hello everyone, my name is Shiv Shankar and I am a software engineer in Bangalore. Today I'm going to interview Dr. Hiral Vyas, who is an Ayurvedic doctor, and the topic is her perspective on the coronavirus and the present situation. So this interview assumes significance as there is an increasing perception that the government, mainstream media, and even social media, they are not providing a neutral, unbiased platform where the truth can come out regarding coronavirus. So some examples being, the first one I would highlight is the testing method being used. So RT-PCR is the testing method used, but the government is not clearly mentioning what is the cycle threshold, which is the configuration used to make the case positive or negative. Second example I would like to point out is that there is no comparison being given with other disease cases and deaths. So if you look at everyday's newspaper or the news channels, the coronavirus cases and the deaths are being shown in a very prominent way. Whereas, uh, what are the comparative study for how many cases and deaths are happening, let's say, due to cancer, due to tuberculosis, etc.? Those are not being shown. The third example I can give is there seems to be a rush to approve experimental vaccines when the medical history shows that no uh, no vaccines has been successfully given to the public over the past few decades for viral infections. The fourth example is that the government is imposing lockdowns, containment zones, and various restrictions, and they are not publishing any numbers as to how many people are suffering due to the lockdowns and maybe even dying due to lack of employment, due to hunger, etc. And they are also not evaluating the psychological impact it is having on the lives of people. So, given this one sided bias coverage of the issue, Dr. Hiral Vyas believes a wider debate is necessary to evaluate the different solutions for the coronavirus and ending the pandemic. So, welcome Dr. Hiral Vyas for this interview and thanks for taking time for this interview.
Hi, thank you so much for invitation to this interview. And so let me just tell a brief about myself. I am practicing Ayurveda and lot of other modalities, and I work with natural therapies. I mean, my therapies are all natural. If I say I'm giving Ayurvedic medicines, it is natural. If I say I'm giving breathing therapy sittings or yoga advice, or if I say like I'm giving you the Reiki healing or something, so everything is natural here in my practice so far. It's been some 11 years now I'm into practice. And right now I don't say I'm a practitioner, I say I'm a consultant, because I have done enough experience and expertise in my field. And in my daily practice, I have seen since last 9 months of this Corona period that I feel somewhere there is a need of public to understand here. Okay, rather than taking out some fault of other system and everything. I know we are going to talk in our debate today about many things, but our main focus today is just awareness. People should understand what is the real situation. Okay, so yeah, we are going to talk about that. And if you would like to introduce more about me, you can go on, and then we start. We come to the point directly afterwards. Thank you so much.
Sure. Thank you, Doctor. So, uh, as a part of introduction, I would just like to mention to the viewers that Dr. Hiral Vyas holds a BA MS degree and she has been an Ayurvedic doctor since 2011 and she has been a researcher since 2014 as part of the Arya Vaidyashala Research Foundation, Coimbatore. She is also an acupressure master since the last 4 years. She is a Mani Reiki grandmaster and practicing Access Bars consciousness therapy since this year. She is also part of an NGO named RVM Foundation Old Age Home, where she is an active participant in social works related to the NGO. We will move on to the first part of the interview. Um, so,
Yes.
Doctor, you can tell us about your experience in treating patients for corona in the last 8 to 9 months in the Ayurvedic way.
Yes. So, first of all, I would like to say, like, I have treated corona patients more over phone, online platforms, because people were scared to come to my clinic, and I was not scared anyway to meet them. But there was a problem with patients to come down to my clinic or take a physical consultation. So I have chosen the way, like, when it is available online, these platforms are available like Zoom meeting or other platforms. We are pretty much comfortable with consultation and the treatment part. So I could not do the physical examination for those patients, but by taking their history and looking at their problems, current, like when they consult me at that moment, what symptoms they are finding, and how it started, from where they catch the infection, and what are the symptoms. After I learn the case, I start my treatment. Like, I'll tell you, I have not given any jadi booty which is only for corona. Okay, because in Ayurveda we give lot of herbs and lot of kashayam and kada and all these medicines. And I have put acupressure protocols also for my patients. Not only Ayurvedic, I was giving combined treatment always to my patients. So I cannot say that I have given Ayurvedic treatment to corona patients. Like, it was the multiple modalities I have added to treat my patients, because I'll tell you why I have done added other modalities for corona, because patients only are not getting treated only by medicines. That is what my experience. So some cases where they were positive, some cases they were feeling that they are infected. Some patients, they were, while the screening, they got some symptoms, and maybe it was not a PCR test that time in the exact test, but they could find through that nose, this thing, samples. So like that, like different kind of patients I have treated. In that, some of the patients were knowing they have corona. Some of the patients, they know they have a symptoms which media is talking about, which doctors are talking about in like online platforms and everywhere. They're learning about corona, how it is, because being a non-medical person, they cannot explain about the case the way the doctor can do, right? So according to their explanation, how they are coming to me with what and all complaints, I have given treatment so far. So out of my all the patients who came for me to corona, like just for the corona treatment, let me stick to that, only those patients, not about the general treatment. So for them, I, first of all, basic requirement what I felt was counseling. So unless and until I don't give them the confidence that corona is a minor infection, I mean, it's not so. See, if it is a chronic illness also, being a doctor, it is not ethical to talk to the patient that you are having so and so problems. We are not supposed to talk to the patient what seriousness is, okay, about their case. So first of all, I felt like with the counseling, lot of cases became so easy to treat. First thing was necessary was in my treatment protocol was basic was counseling. In my counseling, I used to tell my patient that, listen, you have come to me, now you forget about your problem. First of all, I have given the confidence that I will treat you, which no doctor is doing today. Okay, so I'm not blaming here any doctor. See, I am also a doctor. I come from a medical field. I don't want to blame anybody here, or I don't want to tell that other doctors doesn't know what I know. That is not the point here in our meeting today. But I feel when I get the patient, they have gone to some other doctors and come to me. Okay. So where they listen something from the doctors itself, and then they listen from me that I am telling I can treat corona. Many of them are not ready to believe at first consultation. Okay. They doubt themselves because the previous doctor has already told it is not possible to treat. Okay. Like, we are trying. This is the statement from all the other doctors. So my point here is in this discussion is why doctors can take, in charge, I mean, that charge to tell, and with that confidence that, okay, look, you have come to me, I'll get some solution, you will be out of this problem. Okay, If tomorrow the patient is going with a serious problem also, you should be capable enough to handle that. Right. So if you cannot give that confidence, I am not talking about the clinicians here. See, I am a doctor who is sitting in the clinic. I am not handling any hospital right now. Okay. So I can understand the emergencies of ICU level also, because I have friend who is, her name is Dr. Joshi. She is Jyoti Joshi from Maharashtra. She is consulting corona patients. She is treating since last 9 months, sitting inside the ICU. Okay, you can Google it out. You can go and check with Facebook updates or Instagram or Twitter, anywhere you can go and check about Dr. Jyoti Joshi. Okay, she is MD specialist, and she is in Maharashtra. So she is working because Maharashtra government has permitted her to give Ayurvedic treatment, Kada and Kashayam, and whatsoever she can write in ICU. Okay, so she has done a lot of documentation. She has published her research paper as well. I am also into research paper. I have done a lot of case studies, and I have done all the documentations for my patients as well, which I am going to represent with Ayurveda Shala Pharmacy tomorrow. And I am into the process actually, because it is a lot of data. I need to convert it to case reporting, and then I can submit it to AVP. Okay. So I am into that process right now, and I have all the documentation. Tomorrow, if I need, I can create n number of papers out of that. Okay. So this I want to tell, because see, here this example is a beautiful example by Dr. Jyoti Joshi, that she is doing wonderful job today. Being an Ayurvedic physician, okay, she has the confidence, and she is able to treat patients who are on ventilation. Okay, tomorrow doctor has already, like today, doctor has told that this patient is no more living. I mean, for few days only he is there. Such cases she has treated, and patients are out of ventilator. Today they are at home safely.
Sure.
So here, this example,
one question here is you said that firstly it is counseling which helps the patient, and after that,
yes,
can you help with any more details on what were some of the protocols adopted in order to make sure that the patient is able to come out of the condition quickly, and typically how long did it take for the patient to either record negative in the tests or
I'll tell you, I'll give the best example. Me and my husband, we also got corona. I mean, that symptoms like complete smell was not there for a week and kind of thing. And like that, similar patients we have treated. I have treated with the symptoms, proper symptoms of corona, and with reports also. So first line of treatment was counseling. After that, I was giving them advice of precautions see, this is mask and sanitizer. I won't believe it is helping much. Okay, I don't believe personally that mask or sanitizer is helping to any of the patient after you get the infection already. Or maybe if you are not having the infection, I don't know till what extent this is helping. I have no idea. Okay, so I would like to tell the protocol points here is, first is counseling, then preventive measures. After that, for the treatment, I have given internal medications like Kashayam, or there is a Indukantam Kashayam, which is working wonderfully. It is from Ayurveda Shala Pharmacy. That product, Indukantam Kashayam, is a Shastrokta medicine actually. It is written in Samhitas, like how that preparation has prepared. It is not a company like Dabur or something kind of like, which will create their own products. Okay, it is not a generic medicine. It is a Shastrokta medicine. Okay, you cannot call Shastrokta medicine as a pharmaceutical preparation, not a product. Okay, it is a medicine. So like that, there are good medicines like Lakshmi Vilas Swaras is there. That tablet form is there one. After that, like that, many medicines are there, which if I tell all the name here, you can not even understand those names, because it is all typical in Sanskrit. All the names are. So like that, I have given the internal medications as well, Kashayam preparation. I have told them to create the Kashayam at home with the home remedies, like, they can use spices from the kitchen and some green leaves like tulsi or ajwain, this dodapatra and all. that kind of leaves they can add, and they can create their own herbal tea. And morning and evening, twice a day, they can take. They can take hot water throughout the days, but hot water can be taken only the person is not Pitta Prakriti. Okay. So here there are three types of Prakriti as per Ayurveda actually. So if you know the Prakriti correctly, then you can advise the treatment properly. So like how Ayush is talking about some Kashayam and some basic protocol, let me tell you, it is giving lot of complications to public. Okay, because patients are taking just by looking at the advertisement, and government is talking in the name of Ayush name. People are talking about Kashayam and whatever. This protocol is already everywhere, in, globally it is spreaded now. That Ayurveda says these things are helping corona. No, it's not helping. It's helping at some extent to some people, some type of people only, some type of bodies, I can say. Okay, so that analysis and the examination is very important. And after you understand the Prakriti body type of the person, treatment becomes so easy.
Sure.
Then
So
you can
I just
advise
want
accordingly.
to provide the viewers a summary of this, that what you're saying is that one solution fits all does not work here. So
Yes,
based on
yes,
the prakriti of the patient, there will be some customizations in the treatment. And
yes,
depending on the vata, pitta, and kapha elements, and depending on the overall prakriti of the person, the right medicine has to be suggested.
yes, yes, definitely.
Uh,
So this is how. So I don't understand why some companies are coming front and doing lot of advertisement, like, you know, this is helping for immunity boosting, or this is helping to treat corona. And I don't think so. Any such things can help corona patients. And one more thing is, I don't feel corona is very serious issue actually,
yeah,
because
sure. One
see what
last
people are
point
already
here, like how
no.
much time did the patient take to recover from the corona positive condition to become healthy again?
I feel minimum 2 days to 1 week it is taking. Minimum 2 days to 1 week to see the result. Okay, I mean some change in the body. Like today I'm giving the consultation. Tomorrow patient starts the medicine. After he starts, within 2 days he sees the symptoms are reducing. He's feeling comfortable more. He's more active, and the energy level is coming back. Because after getting corona, maximum patient feels lethargic. They feel drowsy. They feel like not doing anything else, and they feel like energy level is very low, because obviously the immunity is getting down, so their energy level is coming down with the symptoms. So I feel that after the treatment, within 2 days they find some treatment effect, and within a week it gets all right completely. I mean they'll forget about the symptoms. That is what my personal experience is. And in chronic cases, I have heard from my group of doctors who are treating corona with Ayurveda and other natural therapies, that maximum they are taking 15 to 20 days any chronic illness of, because of the corona, they are out of corona at least. See, I'll tell you, chronic illness comes only to those patients who already have some health issues already in the body. So uh, corona, handling corona in those patients also is easy. But after getting the corona, the complications because of the other health issues, which is already there in the body, that makes that situation, like, you know, bad, and it makes it more difficult to treat. So here you can understand the difference between the treatment of corona and the chronic illness. Corona is not a chronic illness.
Got it.
Okay, so treating corona is easy, but treating other health related issues which aggravates because of the corona symptoms, which is difficult to handle. But for that, medical field has the solution, right?
Yes.
So that is their job to handle afterwards. So they're not doing it because they just get the first excuses that patient is corona patient. After that, they will not concentrate because they give themselves the statement that patient is having corona. So it is difficult to treat, and they'll take it easy. And maybe, I don't know, maybe they are taking it seriously. Maybe they are taking, like, you know, good serious treatment they are giving for those things. But why then this current situation is happening in the world? If those doctors are handling everything so well, if everything, see, for heart patients, researchers have done, lot of researches happening already happened. Lot of medicines are there. Lot of pharmaceutical companies are preparing medicines for kidney. They're preparing for liver. Then when corona comes, why they are not able to treat with those medicines, which is already there? Lot of vaccines are there for cancer patients. Why cancer is still exists in this world and it is increasing day by day?
Yes.
In spite of taking cancer vaccines, why cancer is still there in this world?
Yeah. So we will just move on to the next section.
Yes.
Where,
Next topic. Yes.
Where it is very much related to what you are speaking now. We will speak about how the medical fraternity is currently counting the number of positive corona cases and deaths attributed to coronavirus. So I would like to give some context to the viewers. So the latest numbers that has been published is that there are 113 million cases that has been recorded so far. So this is across more than 1 year of data and across the world. And the total number of deaths recorded is around 2.5 million deaths, both including 2020 and 2021 so far. My first question, can you tell me your opinion about this counting of cases? So, do you believe that only recording a case as corona case and then treating for that particular method, is it the right way to go? And I will follow it up with other questions once you give the reply for this.
See, the number is not important here. Actually, why they are giving the numbers and why the world is behind the number, I don't know. I have no idea about it. But I feel they are using their energy at wrong place.
Yeah,
taking out the numbers
just
and
give
counting.
the context to the viewer and as well as to the doctor here. So what the point here is that all the newspapers, all the news channels only give the number of corona cases as well as the deaths attributed to corona. But the question here is, why is the same mainstream media, the government, not talking about the other cases? For example, you spoke about cancer, there is TB, there is the pneumonia, seasonal flu, etc. And just to give some numbers in order to ensure that we are not...
Public is used to already now. Public
Correct.
is used to listening about the corona and they get more TRP, right? If we talk about corona, this
Correct.
is simple
Just to give an idea that not many are speaking about the total deaths that have happened in 2020. To update the viewer, around 60 million people have died, of which 1.8 million deaths has been attributed to corona. And just to give a comparative study, in the same 2020 year, 13 million deaths have happened due to communicable diseases, and around 10 million deaths have happened due to cancer. And if you see HIV/AIDS, which is again a viral infection, and AIDS is basically acquired immunodeficiency syndrome, there are 1.7 million deaths in 2020 itself, which is very comparable to how much deaths is happening due to corona. So, doctor, can you continue? So given these numbers, what do you think, is your view on this? That there is no comparison given in any newspaper, any news channel. They are kind of, if I can use the word, hyping up the corona attributable deaths, which is just 1.8 million out of the 60 million total deaths that have occurred throughout the year. And if you see even other communicable diseases, there are 13 million deaths. So do you want to give your views on that, and what should be the right way to look at this?
See, giving the numbers, it is already scaring a lot of people. Okay. So only I told about the treatment. First protocol is counseling. So looking at the numbers, see, I'm talking about the patients who are already suffering. Okay, for them, this is a shock news actually. Okay, it is making people depressed. It is making people low, thinking about this situation. There are lot of people who are getting phobia nowadays because of the infection, because they feel if they will touch here or somewhere, they will talk to somebody, they'll get the infection. So that kind of new phobia has developed in people right now. I have seen in maximum patients who are already having corona, they are scared. Okay, so and the news channels are talking that way. They will always go and check the numbers. Okay, so today's anxiety will be higher than tomorrow. Okay, it will be like tomorrow, it will be more than today. So like that, it is like intensity is up and down, getting up and down in people's mind. So it is affecting like psychology a lot. Like behavioral therapists are talking actually today. My friends only are telling me that they are having lot of loading in their practice. Online, they're giving counseling sessions, they're talking to people, they're making them understand there is nothing to get scared of corona. And only I can say the numbers only is scaring people. I feel it is not necessary to update so well when there are n number of other subjects in the world which can be also spoken in the newspaper, no news channels. They can discuss about some better situations, what good things are happening in the world, what good things are good opportunities are there around. That also can be a news, no?
Right.
Why only the corona is the news and the hot topic in the world right now?
Sure, I
So this is
agree
all
with that.
created. This is not a natural thing. This is all created by people and government, and everybody is included in this. I mean, this is a game plan for, according to me. Being a doctor, I can understand. Corona is not like a villain in this chapter. This is like in this story, something else is there, which people are not aware about it. It is a game plan.
Sure. So
Whatever it
one
is, but
one last
if you
question
don't have
here.
to know whatever
Yeah.
it is, but if government doesn't not able to give the solution, they don't have any right to create more patients by just by giving the news and spreading the phobia.
Got it. So one last question here. Do you think, like, the last part of this question is that uh, if a patient has tested positive and then, like, he dies due to other comorbidity conditions, so he might be having hypertension, diabetes,
They will
etc.
give the name corona only.
Yeah. So is this, like, according to you, scientific, and what is your opinion on that? Because that might be inflating the numbers here when we are saying 1.8 million
That
death
is what
or.
I said. That is what I explained in detail what is happening actually. Okay, corona is not difficult to treat here because there are n number of viruses around us actually. There are a lot of virus according to Ayurveda, according to our Rig Veda, and all the Chaturvedas are talking about uh, all the infections in the air. They are the Rakshas actually. Rakshasa. And this all Rahu Ketu and all the in Navagraha, there are certain negative grahas also. So in Ayurveda, in Rig Veda also, it is written one sentence. If you go and see this Garud Puran also, it is written in that uh, Devatas and Rakshasas, two types were there, right? According to Shastra. So they are converted in the form of infection today. They are still present. Okay. So now there are a lot of other infections, I mean to say. Why we are scared of this one virus only? Because
Got
this
it.
is created actually by the government, by the media, and by the newspapers and news channels. And lot of media and applications, apps are creating lot of contents which is not right. That are all fraud actually, information. That is all the fraud information which is spreading in the world. In the media form, it is all the fake news, I can say. Maximum news are fake or edited or maybe intentionally done. Lot of things are going on. So I feel like why they're scaring people with this one boost. I mean, one small thing like corona. I don't know whether this research is also right, what they're showing every day. That today this new corona has come. What is new corona? When you don't know about old corona, now today you're talking about new corona. What the hell? That is a bullshit actually. When you don't have any proof that corona exists, what form it is, how it is working, how to be treated, how can you talk about nonsense which you don't know anything? New corona you are talking every day. People are bichara papa people, they don't know about medical terms also. You're talking about nonsense, some different new, like very nice, beautiful names you are giving to the coronavirus. What the hell they are doing? I mean, I don't know. This is a sick actually. I mean, not acceptable at all. Which is not proven. They are giving the stamp. Okay, this is new corona. It is working like this. It is changing the shape. It is changing the action. It is changing the new form. When you don't know the treatment about the new form, why the hell you are talking about the new form?
Yes, so I agree. And
I mean, this is
here,
horrible.
so what you are summarizing this is, it is according to you not scientific, and there is a lot of statistics on very insignificant aspects, which Dr. B.M. Hegde calls it as death by statistics. So you are just focusing on some insignificant aspects and giving so much of statistics that is scaring people, and you are actually not being scientific. So we will move on to the measures introduced by the governments based on their.
I would like to add something about from the previous point. You said no that one point I was about to talk, I forgot. I mean, in between you said something about treatment part, no? Like uh, vaccines. You said about vaccines. Are we coming to the vaccines next topic?
Later, we will come to the vaccines later. So first we will talk about the measures that the government is taking.
So I'll talk about it later. I want to give an example about vaccines and treatment part because it is related to corona. Let me just tell it is a small topic, not so detailed.
Sure.
One example I would like to give. If today there is a cancer patient coming to me in my clinic, okay, so I can say today's world, cancer is not chronic. Because they are thinking corona is only the chronic illness today. I mean, look at the fact, cancer is something which is not treatable according to the science. But Ayurveda, some Guinea-Chune doctors in India and abroad, they are doing lot of struggle and giving results to treat cancer also. Okay. There are no doctor who is famous, like who is treating corona cancer in a alternative therapies. There are a lot of doctors who are treating actually. Why they are not coming front? Okay. So the same example I just would like to correlate here that cancer is not important today.
Right.
People are okay with taking chemotherapy. People are okay with the death because of the cancer, but not acceptable because they are dying with corona, which is very small infection.
Right. So that is where the point that it might
mentality
be
has
overhyped.
changed. Mind has changed of people. It is like people are blind today. Okay. They are just focusing on what media is talking, what news channels are talking. They are just focusing on that. They're believing it blindly actually. That is what I mean to say by this point. Yeah.
Got it. So we will move on to the next aspect, where based on the government's analysis, they are putting down a number of restriction measures. So we will talk about the lockdowns and what collateral damage it will have to the society. So just as an introduction to the viewer, one statistic I would like to set is that in 2020, the total number of road accidents that have happened all across the world and the number of deaths that has caused is 1.4 million deaths, which is very comparable to the 1.8 million deaths that has happened due to corona. So now, given this statistics, can we say whether government can take a measure saying no one should ride car from tomorrow? Because there is a certain probability of a road accident that will happen if you take the car out or if you take a two-wheeler out. So this looks very difficult to digest for us, and we have known that we have to take that risk, and then life moves forward. But for coronavirus, government has imposed very severe restrictions like lockdown, containment zones, etc., which are affecting billions of people. and there is no assessment of the collateral damage it is causing. So, for example, right now, the number of cases in Mumbai. So this, by the way, is just the cases. So many of these patients can be asymptomatic, so they can't be even called patients. So it's around 1,000 per day, and based on this, the government is approving or ordering more lockdowns, containment zones, etc. And similarly, in Bangalore, there are containment zones being created because there is 100 plus cases in an apartment. And the point to note here again is 99% of those cases are actually asymptomatic and they are healthy. So, doctor, what is your opinion on the lockdowns and the collateral damage to the economy? So, please talk about these points.
So actually, see, this is very serious topic actually, which you are talking about, because it is all ignored, I feel. Right? Road accidents and like that, there are many different types of deaths actually. Okay. If you go and see this toxicology, I mean, about this one field is there, no, where there are types of death is mentioned actually. Okay. If you understand that, actually those types are not considered at all in media. They don't know actually how many types of deaths are there. So what about those people? I mean, now few things were already like coming in news always, like about accident and what you said. But right now it is not coming so much. But what they are doing, I feel, is if suppose there are accidents in that, some or one or two passengers were, maybe they were having corona, they find later on, so they will add the numbers that way. Okay, so that will be added to corona, that will be also added to the death of accidents also. So like that, there are errors actually, which are not correct numbers of only of corona patients. They are died, but they were having minor symptoms. Maybe they were not supposed to die, but they died due to the accident. So like that, if you say today some 7 lakhs patients died because of the cancer, and out of that maybe 2-3 lakhs were having symptoms of corona, not the reports also, but they will add 2 lakhs to, they will give the number 3 lakhs. Okay, 3 lakhs people, you take it in the corona department. Okay, you take this case, add it, because the numbers are helping. No, government, it is helping to scare people.
Sure. And
It is getting more solid.
do you approve of these
Yeah.
preventive measures that the government is taking as lockdowns, containment zones?
No, lockdown actually मुझे लग रहा है कि ये सब बकवास है. It is not required only. Lockdown is not helping at all. See, starting में मुझे लगता है अगर lockdown नहीं होता तो that time there was no much spread. Right? People could at least work. I mean, 3 months completely we have wasted, and people became more lazy. Their lifestyle has become so bad. I mean, it was like people are sitting at home and eating, and they're putting up a lot of weight, because I'm a weight loss specialist also. I do workshops and lot of things on weight loss. So I have a lot of clients who are talking about, like, madam, everybody is same sentence. Because of the lockdown, I have put on so and so weight. Okay. So I feel lockdown has given n number of body complications already. Medically, people have developed a lot of problems because of the lockdown. First of all, after that, the stress level. Stress level will affect to your thyroid level. It will affect to your sugar levels. It will affect to your blood pressure. It will affect your mental health also. Everything comes because of the stress. So now, who is already having hypertension, who is already a diabetic patient, who is already a thyroid patient, who is already under some behavioral therapies, who are already having the anxiety problems, those patients has flared up like anything.
Yeah.
After
Also,
the
also, do you
lockdown.
want to talk about, like, people who have lost their jobs? Large. So we are like focused on that section which can survive the lockdowns because they have the cash reserve or they have their savings. But 90% of India, they are reliant on their day-to-day job to give their salaries. And if they don't have employment, that will also cause huge collateral damage. So just like, can you help with your opinion on that?
see, government has done enough for their part. People were not having their food also during the lockdown. There are people who could not have proper 3 times food also. So दिखाने के लिए news में दिखाने के लिए they did lot of exercise that they are doing. They are giving food and everything. Celebrities has got famous whom nobody was knowing. They came on front and given tickets to people and they became hero. They were already hero, but they became more famous after doing their social service little bit. But I'll tell you that government has played so well actually, financially also, that they have done some game, like it was like a play only. They have shown that government was working for people. Okay,
Yeah,
then
even though in
afterwards they started
actuality, like
collecting the
they
fine.
did not, yeah, they did not help the people. Like so they only
Right
collected
now
fines.
they start after the lockdown they started collecting the fine in the name of not wearing mask and so things. So now they whatever little bit help, 1% maybe 0.5% help they have done, and they have collected 10-15% for fine now from people.
Agree.
I am seeing every day on like signals and all, ladies are fighting because they are collecting fine. They're sitting inside the auto rickshaw and they're aged ladies actually who is feeling difficulty of breathing because of the mask. They remove little bit up and down, they'll do, and they will catch and ask money.
Sure.
This practice is happening. What about the after 10 o'clock, no police is there on roadside, then you are okay with corona after 10 o'clock.
Sure. So, can you suggest some measures that the government and media can take where they can be more positive, they can help people to enhance immunity and health and instill more confidence in doctors and public?
Actually, I got a call in between. Please repeat once again. I could not hear.
Yeah. So, can you suggest measures that the government and the media can take to enhance the immunity and health and also instill positive confidence in doctors and public rather than just a scare tactic?
See, actually, government knows everything. Okay, we are nobody to suggest them anything. If we will suggest also, they are not going to listen and they are not going to do anything because they don't have any right and power to do that. Okay, they are only puppets and they are doing something which they are ordered by somebody. So it is all a game plan. They are happy with this actually. Why they will take any measures?
Got it. So let us move on to a personal hygiene topic. Uh, the question here is, what is your opinion on masks and sanitizers? Is it necessary and will it control the spread of the virus?
See, I am not practicing mask and sanitizer myself. Being a doctor, I am not using mask. I am not using any sanitizer in my clinic. And I am not supporting this practice at all because it is not helping at all. First of all, you look at the mask material. In the market, you see what is the actual mask which is not practiced only. Nobody is using that mask correctly. Okay, I'll tell you one example. I was traveling through metro last week. My family was here in Bangalore and I was going somewhere. And in metro station, I was wearing this dupatta that mask because I am against of mask actually. Because I use cotton dupatta because it will be easy to breathe actually. Okay, when you are doing a journey. So my dupatta, looking at my dupatta, that person is telling that you are not wearing mask. We will call police if you will not give the fine. Okay, so this is how they are working because they are pressurized actually. Okay,
Sure.
and you won't
we also
believe that
want to talk about the disposal of masks. So
disposable
what
of
is the
mask.
side
After that,
effect of
how much
using the mask?
kachra is happening? Yeah, it's so much like nobody. We don't know how the disposable method is going. I mean, how it is they are managing. Already, what dustbin we have currently, presently, before the corona, what dustbin problem was there in the world. Now it is more kachra. I mean, the dustbin quantity is more, the material is more, which is not necessary. And I don't know how they are going to discard all these things and whether they are using the right method or not. Already
Right.
some infection is there. Forget about the corona. Maybe patient is having some breathing related asthma or something like that, or other lung related lung cancer or something, or some infection which can spread through the mask. Forget about the corona. People who are working in this department, who are working for dustbin collection and all, they can get other infections, no, because of this mask and sanitizer bottles and all these things.
Sure, I agree.
Is there any management happening correctly by government? I don't know. I have no idea about it.
Yeah, even like I am. I have only noticed that the masks are adding to the garbage menace in Bangalore, and anyway, the BBMP does not have
एक्चुअली
a.
बैंगलोर का तो गवर्नमेंट बीबीएमपी तो मुझे ऐसा मन करता है कोई बीबीएमपी का हेड आके मेरे से बात करे, दो थप्पड़ मारूं मैं तो उसको. मतलब बैंगलोर तो कचरा ही है. बैंगलोर का दूसरा नाम है डस्टबिन, गार्बेज फैक्ट्री. एक्चुअली अकॉर्डिंग टू मी, Bangalore was a garden famous for flowers actually years back. I am in Bangalore since 16 years today. I am a Bangalore citizen today, but I have seen Bangalore in 2005 also, and today is 2021. This is not that Bangalore actually.
Got it. So the
And
summary we want to tell
after
the
this
viewer.
corona, I don't know what will be the situation currently about garbage management and all. I don't know. I think the government should think seriously about this and take some action, actually, at least to manage the garbage, because of this all rules and regulations of using mask and sanitizer bottles. You think how much plastic is getting used in the name of sanitizer bottles? We were thinking about, like, we should ban plastic. I mean, we could work a lot actually. Bangalore mein, I'm so happy about one thing, that Bangalore is not using so much plastic bags. Nobody is using plastic bags, but now bottles are getting used in last 9 months, which was not used so much plastic in last 5 years also. Maybe that much plastic we are using in the name of sanitizer bottles.
Sure. The summary we are saying here is that the government should use the funds that they are currently using on corona, masks, sanitizers, etc., on garbage disposal policies and keeping the city neat and clean, which itself can help improve the health of the citizens. So, at least from what you are saying, the summary is that masks and sanitizers, there is no recorded proof that this is helping, and we should more focus on keeping the
Just
city
like
clean.
the vaccines, how they are talking, no, vaccines will help you. Like that, mask will help you and sanitizers will help you. I can say vaccine, mask and sanitizer, all three are brothers and sisters.
Sure, we will come to the
They are all
topic of
relatives.
vaccines. So we have come to the next section, where what I want to ask you is, will you be taking the vaccine, and what is your point that should the companies who are producing the vaccine be liable for any side effects and the adverse reactions that they create? And given that the vaccines are still experimental, is it safe to test it out on large populations?
I feel it is not safe, and vaccines should not be taken for corona, because nobody knows that how corona is reacting actually on body. Nobody knows that statement. Nobody is able to give the statement how corona is working on your body. Who the hell that person are creating this vaccine? I don't know. I don't understand, because it takes years together to create one vaccine. How fast and speedy they already, okay, we have vaccines today. What the hell? This is not practical actually. According to me, vaccines are not vaccines. It is just some, like, sheet of some drops which they are creating out of some viruses and all. Kill the virus and bacteria will create vaccines, right? That is the science. Now they don't know about corona. They are so scared about corona. How can they take some corona only and create a vaccine without understanding the nature of corona?
Got it. So, do you want to speak about what are the Ayurvedic alternatives that can help the situation? Because the government is coming in a way as though vaccines are the only solution. even though it is experimental, and they are almost blocking
Government
any
बात ही मत
Ayurvedic.
करो, government है कौन भाई? I don't understand government. Government का कुछ रोल ही नहीं है कोरोना में. Government is a medical field. Government knows anything. What is doctorate field? What is science? Government knows anything? Any idea about the corona? Anything? No. But government will do what is in the profit. I mean, what is their profit? If they will buy certain vaccines from certain countries, what is their profit? That's it. They can show it to people and public. That's all. See, we are doing this for our public. So there is, because there is no one person who is the government, right?
Agree. So, what is your Ayurvedic alternative suggestions, and how can that be made more smooth?
There are n number of alternatives which we can advise to people. Like, first of all, be confident enough on your own self, okay? Because you are alive. Tomorrow, anything is possible. First of all, what people are having the phobia and the depression about the word corona, they should take it positively. First of all, this is today. Corona is there. Yesterday there was this asthmatic TB was there. There are n number of polio, lot of diseases, AIDS. जो पहले था अभी नहीं है. Not that extent, that intensity is not there. So we have come over of everything. Yesterday there was like see, I will talk about this पहले का जमाना, because I am an old doctor, I am an Ayurvedic doctor, so I will talk about that. तो पहले के जमाने में युद्ध होता था, मतलब लोग war and all, like king and all, they will go with the war situation and all. So they are still alive. No, what has happened? There was a war also. People have died for fighting for the country and the state and the area portion. They were for king for that area and all. So everybody is alive, still today. Whatever diseases has come, it has passed already. So first of all, don't get scared. Take it positively that okay, today corona is there, tomorrow some other disease also will come. Why can't you get prepared with new terms and disease names? Sure. I'm not telling you get used to, but at least take it in a positive way that we can come over this situation. First of all, understand the practical situation. What is the situation right now? How you can take it positively. Okay. I'm not telling if you are sick, still you be positive, you be happy, you laugh and you enjoy. I'm not telling that way, but you take it positively in the sense you be confident enough that you can treat yourself. If anything happens today, you can treat yourself. Suppose you are already having corona. There are a lot of alternative therapies like Ayurveda, like homeopathy, like yoga, like breathing therapies. Lot of things are there in the world which can help you. If you go to a certain doctors or therapists, they will guide you step by step with the protocols and with the possibilities. They will talk to you. Go and get consultation. Go and take seriously treatment. Be positive with the treatment. Whatever they have advised, do it correctly and don't get scared. You will be out of that.
Sure. Do you also want to talk about what can the government do better in terms of the process they have set up? We have seen that they have blocked any Ayurvedic treatment getting recognized. So we have seen Baba Ramdev's case where he has tried to propose solutions, but those were banned. Then we have also seen in Karnataka Dr. Giridhar Khaje's proposals. And the perception being given is that the process has been made deliberately difficult for any alternative medicines and processes to be in place, and the only path is for the pharmaceutical industry to bring in the vaccine. So do you want to just talk what can the government do better in terms of allowing alternate medicines to come up?
See, first of all, government doesn't want to treat patients only. That is very clear. In so many months, government is not bothered about public actually. If you will wait for government to do something, it is never going to happen. Because it is our government. We are the people who encourage them actually. By supporting their whatever theory will come out tomorrow, we are okay. Government is telling this, government is telling that. So I feel like people should come front and they should take action. They should be serious about their own health and how to get out of this situation. First of all, forget about the government. They are not going to do anything. If they want to do, they know what they can do actually. They know very well. Because there are doctors whom I know, Ayush is trying hard. I mean, a lot of department, they are already trying very well to reach to government and talk about this. They are not supporting them. Okay. So today, actually, I have treated many families of doctors actually who are allopathy practitioners. Their family also have come and taken my treatment for corona. So they are believing, actually, they know that Ayurveda can help somewhere. Alternative therapies can treat corona. They know there are things which can help actually this situation. But who will help actually? Is there any one person whom we can go and talk? Any one community who can support this? So I don't know how to explain about this point, but I feel the government is not going to do anything.
Got it. So we are saying that the people should come forward. The last point is,
yes, people should come forward. They should be in yes.
Yeah. So, what would be your final message to the public regarding the health precautions they should take for handling the viral infections and the pandemic that we are seeing?
See, I feel a public should first of all not get scared of anything. They should be positive. They can take precautions like they can focus on their immunity level actually. They can, follow some natural health lifestyle like, they can do some exercise, yoga, they can work out little bit and they can focus on their current health. Whatever condition is, currently what health you are having already, you can maintain that, you can improve that by your own efforts actually. By being positive, you can work on yourself. If you can maintain whatever health you have today, whatever immunity level you have, if you will work only on immunity, no corona will affect you. Let me tell you very clearly. No corona can scare you or it can come to you. No corona can touch your body if you are not allowing that. Because according to the healing field, okay, I am telling you, if we will believe that we will get the infection, definitely we will get the infection. Because we are inviting by saying our body only that okay, I'm going to get the corona infection. Definitely you will get the corona. If it is not corona, your mind only is accepting that you have corona. So you will develop automatically feeling those symptoms and you will not go to the reports. Then maybe it is not a corona, but you will believe it is a corona. You will believe that it is a corona symptoms and you will take the treatment. So it is up to our mentality, our mindset, how we will accept the situations day by day in our daily routine life, how we will work, how we will act, how we will think, how we will eat. All these things will matter actually. So I feel you go and follow some natural path of your lifestyle and, go back to the Ayurveda and go back to this world which was there before some years, like some 100 years back, how this world was working. Like that, you can follow something and change little bit your lifestyle and food habits. Go for the healthy foods, local food. You can have a hot water practice. If you are not a Pitta Prakriti, if you are a Kapha Prakriti, you can definitely take hot water. But you can consult some nearby doctors who can guide you well for all this. Don't follow Google. Don't follow the news channels. Don't follow the some post which is created by some people just to get the likes on the post. Okay, so just accept something from the media wisely actually. Okay, think before reading also. Think before digesting something, what you are going to digest. So that is the best message I can ever give about the corona or any disease XYZ. First of all, the mentality and the lifestyle and habit. I mean, it matters a lot for any diseases.
Sure. So, thank you, Dr. Hiral, for all your inputs and taking your time to educate the public on your views about health and how to face this virus problem. Uh, and I genuinely hope that, like, you will become the health minister of this country, given that that is your desire. And uh, in that position, you will be
That I
able
will
to take
become
the society
definitely.
forward. So I conclude this interview
That
with
is for sure. There is no doubt that I will not become. One day I will become the health minister and I will change this book name only of government. What book they have written since the government is there in the India, I will change the book name itself, not the chapters only.
sure.
There will be
Thank
no
you.
book actually. Everything will be open.
Sure. Thank you. And I conclude the interview with a Sanskrit mantra for global health. Om Sarvesham Swastir Bhavatu, Sarvesham Shantir Bhavatu, Sarvesham Purnam Bhavatu, Sarvesham Mangalam Bhavatu. Om Shanti Shanti Shanti.